Hello everyone, this is Dr. Anulekha and welcome back to my YouTube channel. This channel is a result of my passion towards obstetrics and gynecology and towards teaching. Here, let's learn everything together. Today's topic is miscarriage. Miscarriage is the involuntary spontaneous loss of pregnancy before 20 to 24 weeks. And the most common cause of miscarriage is in first trimester is sporadic chromosomal errors, and which can be of two types. They are numerical chromosomal abnormalities and structural chromosomal abnormalities, of which the numerical chromosomal abnormalities are most common. And these spontaneous abortions contribute to 50% of total abortions. And the spontaneous abortions can be embryonic or anembryonic. Anembryonic is otherwise called as blighted ovum. In embryonic, chromosomal are the most common cause. As I already mentioned, they are the most common cause of abortions in the first trimester. And of the chromosomal, trisomies are the most common type. The different types of abortions can be threatened, inevitable, complete and incomplete. As the words are mentioning, and they are itself saying, threatened abortion is a type of abortion where the mother does not lose the pregnancy yet, but it is just threatened, like the mothers will have spotting or mild bleeding PV. The products of conceptors are not yet expelled, and the os is also closed in threatened abortion. Coming to inevitable abortion, as the word is itself saying inevitable, that it means that the abortion is inevitable in most of the cases. In inevitable abortion, it means that the os is open and the products of conceptors are ready to expel out but not yet expelled, and there is also bleeding PV or spotting in inevitable abortion. Coming to incomplete or complete abortion, the next step of inevitable abortion is incomplete or complete abortion. Incomplete abortion, in incomplete abortion, the os is open. So the os is open in both the ends, that is inevitable and incomplete. So we can remember this as come in. To ask a person or someone to come in, the door needs to be open. Similarly, in inevitable abortion and in incomplete abortion, the os is open. In inevitable abortion and in incomplete abortion, these two coordinate each other. Like after inevitable, there occurs the incomplete abortion. Here, certain products of conceptors are expelled out. The patient or the mother tells us a history that she is able to perceive certain things coming out of her vagina, or she tells us a history of certain clots from her PV. So the next step of incomplete abortion is complete abortion. In complete abortion, the products of conceptors are already expelled out and the os is also closed in complete abortion. So these are the four types of abortions which we have to know. So for those attempting the NEET PG examination or any entrance test, a most key word here is in which type of abortion the os is open. So as I already mentioned earlier, os is opened in both the ends, that is inevitable abortion and incomplete abortion. So as I already told you, in the first trimester, the most common cause of abortions is chromosomal, and in chromosomal, the most common types are trisomies. And in trisomies, the most common one is trisomy 16. So, coming to the second trimester abortions. In second trimester, the most common cause are anatomical, that is the anatomy of the female uterus. In this, we have the septate uterus, which is the most common type, followed by bicornuate and followed by the incomplete os. Incomplete os means the incompetent cervix or the short cervix, which is less than 2.5 centimeters. And coming to the third one, that is the maternal infections. So maternal infections can occur in any trimester. There is no particular trimester to which we allot this category. And in maternal infections, we have syphilis, SLE, Aplar syndrome, diabetes mellitus, torch infections, TB, cancers, celiac disease, and thyroid disorders. So the definition of in recurrent pregnancy loss is losing greater than or equal to 2 pregnancies. So the causes can be chromosomal, which is the most common type, followed by anatomical, followed by maternal infections. And here the key important thing is torch infections, which come under maternal infections, do not cause a recurrent pregnancy loss. They have the chance of causing pregnancy losses, but they do not cause a recurrent pregnancy loss. Next, in the anatomical causes, I told you 3 types of anatomical losses. First one is septate uterus, second one is bicornuate uterus, and the third one is incomplete os or short cervix. So, if the mother is having septate uterus, which is also the most common type of Mullerian defect, and this causes second trimester abortion. So if she's having septate uterus, what are we going to do next? The management is hysteroscopic resection of the septum, so that the uterus becomes, so that we remove the septum and the uterus becomes normal like others. The second one is bicornuate uterus. In bicornuate uterus, we do Strassman metroplasty, which is a unification surgery. Here we are having two cornea of the uterus. So when we do the Strassman metroplasty, the unification surgery, then it helps in increasing the chance of continuing the pregnancy. But this Strassman metroplasty or the unification surgery is indicated only in case of recurrent pregnancy loss. So what is the definition of recurrent pregnancy loss? It is loss of greater than or equal to 2 pregnancies. So only in this condition we do Strassman metroplasty. So in which condition we do Strassman metroplasty? It is done for bicornuate uterus, and hysteroscopic resection is done for septate uterus. The next one is incompetent os or short cervix. The short cervix means less than 2.5 centimeters. So the management of short cervix is encirclage. It is applied greater than 12 weeks and removed greater than 37 weeks. And the most commonly used cerclage is McDonald's cerclage. Next, thrombophilias. A thrombophilias can be inherited or acquired. The inherited thrombophilias are factor V latent mutation, methyl tetrahydrofolate reductase gene mutation, prothrombin gene mutation, protein C and S deficiency, and antithrombin 3 deficiency. These are the inherited thrombophilias. And the most important one is in the acquired. In acquired, we have antiphospholipid antibody syndrome, and there are 3 antibodies which are present in antiphospholipid antibody syndrome, and they are lupus anticoagulant, anticardiolipin antibody, anti-beta-2 glycoprotein antibody. So in the MCQ, we might be asked about which of the following is not the antibody present in ABRA syndrome. So we need to remember these 3 antibodies very well. They are lupus anticoagulant, anticardiolipin antibody, and anti-beta-2 glycoprotein antibody. The next one is hyperhomocysteinemia. So now we will learn the criteria to diagnose antiphospholipid antibody syndrome. There is clinical criteria and the lab criteria. First, let us learn about clinical criteria. There are 4 in diagnosing antiphospholipid antibody syndrome. The first one is greater than or equal to 1 venous or arterial thrombosis, or greater than or equal to 1 morphologically normal baby lost after 10 weeks, greater than or equal to 1 morphologically normal baby lost before 34 weeks completed, or greater than or equal to 3 abortions before 10 weeks. So if a mother is having greater than or equal to 3 abortions before 10 weeks or any of the 3 mentioned above, then think about antiphospholipid antibody syndrome. After clinical, we have the lab criteria. In lab, we have anticardiolipin antibodies, which are IgM, which can be IgG, and lupus anticoagulant. So the management of this after diagnosing antiphospholipid antibody syndrome is low molecular weight heparin or antiplatelet drugs, which increases the outcome of pregnancy. So let us learn part by part. Let us learn slowly and perfectly. So today I told you about abortions or miscarriage definition and most common cause of first trimester abortions, most common cause of second trimester abortions, and in second trimester abortions about the anatomy of the female uterus, and in which septate and bicornuate uterus are most common. In septate, what do? We do the septal resection, and bicornuate uterus we do unification surgery. And I told you about antiphospholipid antibody syndrome, which is very important, and the antibodies which are present in antiphospholipid antibody syndrome, and the criteria through which we diagnose antiphospholipid antibody syndrome. So in my next class, we will learn some other topic, and these are all a very small videos, so that it will not consume much of your time, and you can watch them in your free time, so that listening something more times helps us to remember it better. So I am doing these videos because during the last days of my preparation, I listened so many things so many times. So during the exam, while marking some MCQs, these points which I saw in videos, which I heard, struck me, and it gave me better results. I hope this video helps you all too. Thank you.